So quite frequently in the clinic, we see a lot of people with hip pain in this area. And there's a lot of important things in this area, and I'm going to discuss why this happens, and I'm going to give you some strategies to help manage this. One of the big issues a lot of people will have when this is aggravated and inflamed is they have difficulty lying on this side, sleeping on this side during the night. Unfortunately, they also have a lot of trouble when this leg's on top during the night. So I'm going to explain to you why that happens and how to manage this better. So basically in this area, you have muscles and tendons. You have your gluteal muscles, specifically gluteus medius and minimus, and they come down off of the pelvis here and they attach down here on the femur. Under those tendons, you have a bursa sac, which helps cushion that. I will show you that right now. You can see in this picture here, you have the right innominate bone, which makes up 1/2 of the pelvis. The head of the femur, the greater trochanter, the gluteus medius muscle as it attaches from the pelvis down to the femur, and here, the bursa. Notice how that bursa sits under the glute tendon and cushions it so it doesn't rub on the bone. Okay, so why does it hurt when you're lying on it? If you can picture from the drawing, that bursa sac is right in this area. And so when you're lying on this area, whether it's the bursa or the tendon that's inflamed, you're putting your body pressure directly on this area that's already aggravated and irritated. On the flip side of that, if you're lying on your opposite side, a lot of times the reason this hurts is because this muscle that attaches here to here is lengthened and put on a stretch because this leg is falling down when it sits on top of the other one. Just picture sleeping like this and that leg falling down. So let's discuss what we can do to decrease this pain. When you're sleeping with your left hip down, one of the most important things you can do is to make sure you don't put weight directly on this hip. So there are 2 ways you can do this. When you lie on your side, position yourself so your weight is slightly behind the hip bone on the lower leg, or do the opposite. Roll forward a little bit so again, your weight is not directly on the hip bone. Now, if you're going to lie with your left leg up on top, what you want to do is prop a pillow between your knees. Because what that does is that keeps this hip in a good alignment. It does not allow the leg to fall down and put that gluteus medius and minimus tendon on a stretch. See the difference? So, if you're having pain in your hip, especially on the outside like this, make sure to come see us. We can help you get rid of this pain long term. But in the meantime, if you're having pain while you're trying to sleep and this is keeping you awake, try these tips. They should help you sleep more restfully without that discomfort in the hip. Thanks for watching the video. Make sure to subscribe if you haven't done that already and check back for more tips and tricks. Thanks for watching.